Hello, this is my IM injection video. To begin, I will wash my hands. I will then open my MAR and to be giving naloxone 400 mcgs IM stat. So I would begin by gathering my supplies. First, my medication. Naloxone, 0.2 milligrams per milliliter. First check done. I would check it against my MAR. After doing some calculation, I would know that I'm giving 2 milliliters. I would gather a syringe and a needle. I would also gather alcohol swabs. After this, I would prepare my vial, swabbing the top and letting it dry. I would then open my syringe, keep it in a sterile fashion, and I would open my needle. I would connect the two. I would pull back the safety and uncap my needle. I would draw back 2 milliliters of air, place it into my vial, which has already been cleaned off. I would inject the air and invert. And then I would pull back 2 milliliters. Pull back 2 milliliters of liquid. A little access so we can get the bubbles out. I would make sure all the bubbles are out of my syringe. Then I would push it back to 2 milliliters. Pull it out of my vial. I would then use the scoop technique to recap my needle. I would secure it. Close my MAR, put my needle on top, gather another syringe, put my medication back for my third check. Naloxone, 0.2 milligrams per milliliter. After that, I would lock the cart and I would consult my drug guide. I would know that naloxone reverses excess opioid use and that it has to be given either as an IV or an IM injection. I would know that I'm giving an IM injection, and then after all my supplies is gathered, I would go to my patient's room. Upon entering the patient's room, I will provide privacy. I will then move over to my client, provide hand hygiene. Hi, my name is Cassie. I'll be your nurse today. And we're going to be doing an intramuscular injection. Can I start off by getting your name and date of birth? As they're stating their name and date of birth, I will check that. And do you have any allergies that you're aware of? No allergies you're currently aware of. Okay, that's what your allergy band says. I will remove the bed to working height. Before we begin with the injection, do you have any questions? No questions for me. Okay. Before I give your injection, I have to get your vitals. I have to make sure to check your respiratory rate, ask your level of pain. I will take your blood pressure, and then I will get your pulse. After that is all completed, I can move on to your injection. So today, like I said, we're just going to give you an intramuscular injection. To begin that, I will put on gloves. Injection today in your dorsio-gluteal, which is the back of the hip. To begin, I will find your 3 landmarks. It will be posterior superior iliac spine, your greater trochanter, and your sciatic nerve. First, I will swab the site after I found the landmarks. I will let it dry without fanning or blowing on it. I will then uncap my needle, Z-track the skin, go at a 90-degree angle. This is 2 milliliters, so it should take 20 seconds. So I begin injecting, not too quickly. After 20 seconds, I would then remove my needle, the same degree it went in. I would not recap, I would use the safety. And I'd move these into the sharps container. I would then take off my gloves, throw it in the trash. Alright, after my injection is complete, I will perform hand hygiene. I will move the bed into low position. Are there any questions you want to ask me? Anything else I can get for you before I go? No? Alright, before I go, I would make sure that you have fresh water and that your room is free of clutter. I would then show you your call light is over here, and when you press the call light, a little light will turn on and I can come answer any questions you have. Again, my name is Cassie and I'll be your nurse until 10 p.m. tonight. If you have any questions, don't hesitate to ask. I'm here. And anything else I can get for you today? No? Alright. Upon exiting my patient's room, I would document time, site, date, and initials.